Hi, I'm Dr. Basuito, one of the plastic surgeons at Beverly Hills Physicians, and I'm going to be answering some questions that people had about lip augmentation. So the first question is, what is Juvederm and Restylane? These are both products that we use as fillers. We could do lip augmentation, also filling nasolabial folds. Restylane can be used underneath the tear trough area of the eye. And they're both made of what's called hyaluronic acid. That's the type of product that they are. And second question on here is, what is hyaluronic acid? Well, hyaluronic acid is a glycosaminoglycan biopolymer, which is part of the extracellular matrix in living creatures, also part of humans. And this has been processed, and it's made into polymers, which stabilizes it in the tissue so it lasts longer, so it's not metabolized as quickly as it is in vivo nature when you just have this in your tissue. So it has a good safety profile for this reason. Other older products, you had to get hypersensitivity testing. These, you don't need to do that. And some of the differences between them, one of the differences is the concentration of the hyaluronic acid in the product. The Restylane is a little bit lower concentration than the Juvederm. And then also the other difference is the amount of what they call cross-linking, which is what stabilizes the product when it's in. And the Juvederm has more cross-linking than the Restylane. And next question is, which one do most patients prefer and why? I'd say this depends. I don't know if there's necessarily one that most patients tend to prefer rather than the other. They both have, their pros and cons. Sometimes Restylane may seem a little bit softer in the lips. We use the Restylane underneath in the tear trough. We don't use Juvederm in this area because it draws the water in. So I guess it depends on what you're coming to have done. Both products can be used in the lips. They're both good. So I guess it just depends. Difference between Juvederm and Botox. Juvederm, again, it's a hyaluronic acid filler product, so it's used to kind of if you want to make your lips bigger, or if you have folds that you want to fill in. Botox is a neurotoxin that paralyzes the muscle, so it can be used to treat wrinkles by paralyzing the muscles that are underneath the skin. So that's the difference between the Juvederm and Botox. What will treatment with Juvederm accomplish? So again, it depends on what you're coming to have done. It can be used for many different things. It can be used to make your lips enhanced. It can be used to fill in nasolabial folds or marionette lines, which are the lines that are coming down here. It can be used, sometimes people have little lines either from smoking or from aging. It can be used to fill that in as well. It can be used for chin augmentation. And how long does the treatment usually take? So again, it varies on how much you're having done, but I would say on average maybe 30 minutes. And the treatment, the next question is, does the correction last forever? No, it doesn't last forever. Your body does metabolize this product, and it varies, it depends on your metabolism. Usually varies between 6 to 9 months, especially if you're having it lip augmentation. It's an area where you metabolize things a little bit quicker. And who is qualified to administer these fillers? So you should be seeing somebody who has done injectable training, usually a physician. There are nurse injectors too. Just make sure that they've done the training and courses. There's some nurse injectors that are also very good, and physicians are also doing these injections, but definitely make sure it's somebody who's done training and the injectables. Will I be given some sort of anesthesia or numbing cream? Yes. We use a numbing cream. We can also use a shot called lidocaine, which would numb up a region of your skin, so that way you didn't feel it. But the numbing cream also works. You put it on and you don't feel the needle as much. And we also use ice too. Ice helps to cool the skin, make the injection a little less painful. So we do try to make it as comfortable for you as possible. And can I apply makeup after the treatment? And if not, how long do I have to wait? So I usually ask patients to wait at least several hours after the treatment, at least long enough until the little areas where we put the needles in have healed over. If they can wait for the rest of the day, that'd be great. Sometimes they can't, and then at least several hours until they put makeup on. Ask them not to work out after for, till the next day, to be sitting up, not to be lying down, don't go do your yoga class right after or anything like that. So that's all the questions that I have here. They were really good questions. Is there any others that had come up? Okay, great. Hopefully this helped, and if you'd like to come in for a consultation about lip augmentation or any other areas where you'd think that maybe you need fillers or Botox, we'd be happy to see you. Hope everybody has a great Valentine's Day. Thanks.